Yeah, the health concerns, the biggest issues are diabetes. Diabetic retinopathy is one of the leading causes of vision loss. Also, macular degeneration is another common problem. Cataracts are also something that can cause decreased vision.
What are some of the symptoms of glaucoma?
Well, glaucoma, unfortunately, is a painless disease. Some patients have acute high eye pressures that may be painful, and when they see their eye physician, they may be diagnosed with high eye pressures and glaucoma at that point. But for the most part, glaucoma is painless, and patients don't know they have the disease unless they're screened or seen by a eye care professional.
Any hints that you want to give in terms of eye care, how someone might protect their vision?
Yeah, I think if you have any underlying diseases, especially diabetes or high blood pressure, then it's very important that you get a dilated fundus exam at least once a year to make sure that the eyes are healthy.
Any other comments you'd like to make?
No, I want to thank the Society of Prevention of Blindness Society of Metropolitan Washington for inviting us out here today and to help all the patients in Bowie.
Hi, can you tell us about what you're doing today and your name?
Okay, I'm Dale Grant here at the Senior Center in our computer lab, and what we're trying to do is give out information on the various sites that you can go to for good information from on almost anything health related that you can name. There's a site out there that will give you some information. We have a list of 100 sites that have been vetted, that they're not just advertising on there. There's good information, and so we're trying to get people to be aware that all this information is available out there. And there's a particular organization that does have this list of 100 sites. It's CAFIS, and cafis.mlanet.org. It's where you go, and you'll find that there's 100 sites that have information. As I say, there's lots of good information on the net on practically any condition that you might be concerned with. For example, the NIH has a site that explains conditions and the symptoms and treatment for a lot of different diseases. You have other sites, like there's a site on this list that I believe it's called RX List, which is a list of internet information on medicines. There's something like over 200 drugs and the things that you want to know about the drugs. And so there's just a wealth of information out there. And as I tell people, as I give them the list, if you've been told that you have some particular condition, you want to know everything there is to know about that condition, because let's face it, the doctor just is not going to be aware of or be able to tell you all the different things that might happen with your condition. And if you can go out there and learn everything you can about it, then you're going to be much better off, and you'll end up with better treatment because you know what to ask when you talk to the doctor. You know what symptoms you're having and whether they're relevant to the particular condition. So it's a great way to keep track and make sure that you know what's best for you.
These 100 sites, they're reliable sources of information, correct?
Right. They've been vetted, and so that someone has already checked and made sure that the information that's on these sites is real and accurate, not something that somebody's not just trying to sell you something.
And can you tell us that website again that we can get this list from?
Okay, it's CAPHIS.mlanet.org is the site that you want to go to find that information.
Well, thank you, Dale. Thank you very much for your time today.
You're welcome.